The drug therapeutic guidelines are a listing of the indications, dosage regimens, duration of therapy, modes of administration, monitoring parameters, and special considerations for use of a specific medication or medication class. In a hospital, these guidelines are developed with the oversight of practitioners with expertise in the use of a specific medication or management of a disease state. The development of the guidelines is often a result of medication use review or medication safety evaluation. A review of this data may indicate the drug is not being used in an optimal manner with regard to patient selection, dosage, frequency, route, length of therapy, or a combination. The guidelines are often put into practice via a pre-printed physician oath sheet placed in the patient chart or computerized oath set. The development and the implementation of guidelines may foster the safe, efficacious, and cost-effective use of selected drug products. As you may know, in Taiwan, we are under an uni-insurance-covered system. As the drug being reimbursed, the guideline or criteria for using the drugs is announced to guide the prescriber following the criteria of drug usage. This is the example represent the criteria set by the National Health Insurance Administration for a new oral anticoagulant, apixaban. This slide demonstrates some examples of warning screens in our prescribing system. In the upper left, it shows if the patient has any drug allergy history. The system will pop out a warning message to notify physicians. In the upper right, the adverse drug reaction warning is designed to remind physicians to be more careful for certain drugs when prescribing. In the lower left, the dosage form check can prevent the drugs to be splitted or crushed from being administered by inappropriate routes, such as nasogastric tube. In the lower right, if the diagnosis not compatible with the antibiotic prescribed, the warning message will pop out to warn the physician. The P&T committee is responsible for medication use in the hospital. This includes the development of guidelines on historical pharmacy-related topics of medication procurement, selection, and distribution. In addition, they are responsible for administration process. This may include determining what medications are administered in specific locations, such as intensive care units, or under specific conditions, for example, by chemotherapy certified nurses. Finally, they define the formulary management process, specifically guidelines for the evaluation of medication by the P&T committee, frequency of such review, maintenance of the medication list, etc. This is an example of the drug management screen for pharmacists. In our hospital, the antifungal drug is restricted to certain physician specialties. In this case, the drug is restricted to infection and pediatric infection physicians. Through this mechanism, we can apply the policy of drug use into practice. The P&T committee must communicate its action to health system staff and physicians. A newsletter is often employed to communicate these decisions. The newsletter may also include clinical information on drug added to the formulary, drug therapy guidelines developed, and medication safety information available. The success of a newsletter may be limited by the format and the content. The newsletter should be visually pleasing, easy to follow, which is clear and simple. Optimally, it should be limited to 2 to 4 pages in length. The audience for the newsletter is generally broad and including physicians, nurses, pharmacists, and other healthcare professionals. Our method to educate others to P&T committee action are presentation at medical department meetings, nursing unit meetings, and pharmacy meetings. The electrical message may be delivered through email or websites. This is a bullet published by pharmacy department to inform all the clinical department what are new agents in the hospital. Any other information related to supply will be published through email to personal mailbox or the website. To facilitate drug information circulation, we also publish the drug bulletin every month to circulate important drug information to the public. Another publication by our department is the Journal of Hospital Pharmacy. It is a peer-reviewed professional journal, covering clinical case studies, medication therapy reviews, and medication news. We publish 2 issues every year, and it has been published for more than 30 years. For medication use requires special instruction. We also make a series of medication use guided DVD for patient self-learnings. In our hospital, we post all medication information on the website for medical professionals and the general public. We also provide our customers counseling services from the website. In the outpatient clinics, we provide the integrated medication information kiosk to patients. Through the self-operated mechanism, we can save the pharmacy manpower for patient education.